You can spend hours trying to memorize biochemical pathways and rare vitamin disorders, but the nutrition proctored exam focuses on how diet intersects with fundamental nursing safety. It isn't a test of meal planning, it's a test of clinical risk management. Every question on the exam is built around these four specific questions. What harms the patient first? What is the clinical priority? What finding requires an intervention? And what is your very first action? Airway protection and physical safety always supersede caloric intake or patient preference. If an option prevents an infection or protects the airway, it is the priority over feeding the patient. Fresh foods are prioritized over processed options due to the high levels of hidden sodium in canned or deli meats. Additionally, the exam favors managing disease through moderation and substitution rather than the total elimination of food groups. Applying these guidelines allows you to filter through confusing choices and isolate the specific nursing intervention the test expects, without needing to memorize every food item mentioned in the scenario. Take the symptom of edema. While it is often associated with sodium or fluid overload, the exam frequently uses swelling to identify a different nutritional problem. This cross-section of a blood vessel shows albumin proteins. They maintain oncotic pressure, acting like a magnet keeping fluid inside. But when protein is chronically low, albumin falls, oncotic pressure drops, fluid leaks from the vessels, pooling into surrounding tissues, causing swelling. You can identify this specific cause of edema by looking for associated clinical signs, like poor wound healing, signs of muscle wasting, or dry, brittle hair. For a malnourished patient with edema, the priority is identifying that long-term protein deficit, which shifts the intervention toward high protein needs rather than simple fluid management. For a diabetic patient, the goal is glycemic control through fiber and consistent carbohydrate intake. The exam will offer options to eliminate all sugar, but the nursing priority is slowing glucose absorption, not total restriction. In renal disease, managing fluid retention and kidney stress is the priority. This requires a diet low in sodium and processed meats, with protein carefully adjusted based on if the patient is pre-dialysis or in end-stage failure. Dumping syndrome requires the opposite logic to slow down rapid gastric emptying. High-protein foods slow digestion, and patients must avoid drinking fluids with their meals to prevent food from moving through the GI tract too quickly. The correct choice on these questions avoids extreme restrictions and focuses on maintaining the physiologic balance needed to prevent specific disease complications. The stakes increase with enteral tube feeds and parenteral nutrition. In these scenarios, the primary threats shift from nutrition to airway compromise, systemic infection, and rapid glucose fluctuations. Consider this scenario. A patient is receiving total parenteral nutrition, the bag runs dry, and a replacement is not immediately available. What is the first nursing action? You must hang D10W. TPN is highly concentrated with glucose, and the patient's body is producing high levels of insulin in response. Hanging normal saline instead of dextrose will lead to a sudden hypoglycemic crash. Now consider a second scenario where a patient receiving an enteral tube feed suddenly starts coughing or develops crackles in their lungs. When aspiration is actively occurring, repositioning or monitoring is an error. You must stop the feeding immediately to protect the airway. We can apply these safety principles to a final scenario involving an immunocompromised pregnant patient. Which of these two findings requires immediate intervention? A patient thawing raw chicken on the kitchen counter, or a patient eating a well-done, fully cooked steak? Thawing meat at room temperature is the hazard. For high-risk, vulnerable populations, preventing foodborne illness through proper temperature control is the top priority. When you are stuck between two choices, nursing judgment dictates choosing the one that protects the airway, prevents an infection, or halts a dangerous procedure. This summary distills the core principles tested on the exam: safety over calories, protein for fluid balance, sodium for swelling, stopping feeds for respiratory distress, and hanging D10W if TPN is interrupted. Relying on these conservative nursing actions will get you through the proctored exam.